Welcome to the State Personnel Benefits presentation for new state employees. This presentation will cover the insurance benefits offered by the state to benefit eligible state employees. If you have any questions, please feel free to contact the benefits hotline at 317-232-1167 or 877-248-0007, Monday through Friday 7:30 a.m. to 5 p.m. Eastern Time. You may also send an email with questions to spdbenefits@spd.in.gov and a benefits specialist will be happy to assist. In addition, there is a wealth of information available on the State Personnel Benefits website which can be accessed at www.in.gov/spd/2337. Enrolling in your benefits is an online self-service process. It is very important that you enter your elections by your enrollment deadline. Your deadline to enter your benefits is the Monday following the pay period in which you were hired. Your benefits are effective 4 days after your first paycheck when paid through the auditor's office. If you are not paid through the auditor's office, your benefits will be effective the first of the month following the date of your hire. If you elect one of the consumer-driven health plans, and elect a health savings account to go along with it, your health savings account will be effective the month following your benefits are effective date. Again, it is imperative to get your elections entered by your deadline. Make sure you do not wait until the last day to do so, just in case you need to call with questions or make changes before the deadline. Some of you may already be familiar with these insurance terms, but for those of you who are not, these are frequently used terms that are important to know to help you make an informed decision when selecting your benefits. A premium is the biweekly amount that is deducted from your paycheck for your elected insurance plans. This is the amount that you pay to have and maintain the coverage. The deductible is a set amount that you pay before your health plan begins to pay co-insurance. The out-of-pocket maximum is the total amount of money you will have to pay in the year before you qualify for 100% coverage. Premiums do not count toward the deductible or out-of-pocket maximum, and you must still pay premiums even if you have met the out-of-pocket maximum. Dependents eligible to be covered under your plans are your spouse and children. Children can be natural, step, foster, legally adopted children or children who reside in the employee's home for whom the employee or spouse have been appointed legal guardian. Children are eligible to be covered until the end of the month of their 26th birthday regardless of student status. Disabled dependents over the age of 26 are eligible to remain on your plans as long as you follow the appropriate steps and requirements for verification. You must contact the benefits hotline prior to your benefits deadline to initiate the eligibility review process for your disabled dependent aged 26 or older. Upon your request, Anthem is notified to mail you an application for continuation of coverage. After your initial hire, you must contact the benefits hotline within 31 days after a disabled dependent turns 26 in order to initiate the eligibility review process. If any of this applies to you, please contact the benefits hotline so that a benefits specialist can assist you with this process. Each year, random audits are conducted, and employees may be required to provide documentation to prove that their dependents are eligible for coverage. If you are selected, you must sign an affidavit and provide the required documentation. This documentation is not required now, but it is a good idea to ensure you know where all this documentation is located so that it can be easily accessed if the time comes to provide it. Examples of what may be requested are a marriage certificate and front page of the most recent tax return if you are married, and birth certificates if you have children covered. Benefits enrollment is a self-service process done online through PeopleSoft. In order to log into PeopleSoft, you must set up multi-factor authentication, MFA. To start your benefits enrollment, go to myshare.in.gov. Then select the PeopleSoft Human Resources link. Log into PeopleSoft by entering your email address and selecting Continue. Once logged in, navigate to the Employee Self-Service from the homepage. Next, select the Onboarding tile. After selecting the Onboarding tile, next select the Onboarding Activities tile. The new Benefits Enrollment page displays. Read the Welcome message and select the Next button. The Acknowledgement page displays. Read Acknowledgement and Health Savings Account Eligibility. Check the I have read and agree to the terms box, then select Save. The new Benefits Enrollment page displays. From here you can start to see the benefits you may wish to enroll in. Each employee's benefit selection may be different from employee to employee. Select the applicable benefit plan tile you wish to enroll in from the new benefit enrollment page. Note: you should select the benefit tiles you are wishing to change in order of left to right, top to bottom. Until you submit your elections, your status will be pending review. Start with a non-tobacco user agreement. The state offers a $35 reduction in the biweekly health insurance premium for state employees who agree to abstain from the use of tobacco products for the entire calendar year. The terms of the agreement are listed on your screen but are considered a contract if you accept it when enrolling in your benefits. If you accept the agreement, you are agreeing to be tested for nicotine, and if you accept the agreement and later use tobacco, your employment will be terminated. The only exception to the job loss penalty is if you revoke your agreement by calling the benefits hotline or logging into PeopleSoft and completing the self-service process to revoke your agreement prior to the use of any tobacco product. It is extremely important to remember that this is considered a contract and that testing is done at random throughout the year. Also, while you can revoke the agreement, as it is treated as a year-long contract, you will still be responsible for paying back the premium discounts that you have received for the year in one installment. This is a great incentive, but it is wise to be sure that you will be able to abide by the terms before accepting. You as the employee are the trigger for the agreement. This means if your spouse or children on your plan use tobacco, you can still sign the agreement, so long as you are not a tobacco user. If you are not electing a medical plan, you will waive the non-tobacco user agreement. If you are electing a medical plan, you will either agree or disagree to the non-tobacco user agreement and continue to the next tile. If you are electing medical, select the medical plan tile. The medical plan tile displays. Each benefit tile option will show the plans available to elect and the cost of the plans once the tile is elected. If you wish to enroll dependents and their name is displayed under the Enroll Your Dependents section, you may add them by selecting the box next to their name. To enroll dependents who are not already listed, select the Add/Update Dependent button. There are multiple health insurance plans offered by the state. All plans are through Anthem, and they are the Consumer-Driven Health Plan 1, the Consumer-Driven Health Plan 2, and the Traditional Plan. All plans have the same covered services and are in the Anthem network of providers. The differences are in the biweekly premium, the deductibles, and the out-of-pocket maximums. So, what is a consumer-driven health plan? A consumer-driven health plan is a traditional health insurance plan that provides broad coverage for a wide range of services after the deductible has been met. The plans are considered high-deductible plans. You will pay a lower biweekly premium but pay the full cost of service until the deductible has been met. The full cost of service may be lower if you see an in-network provider because Anthem may apply discounts for seeing providers within their network. If or when you reach your deductible, the co-insurance would begin. This means that Anthem would pay a percentage of the cost and then you would pay the remaining cost for covered in-network services. We will discuss how to determine what percentage Anthem will pay later in this presentation. Preventive services are covered in full on all medical plans before the deductible is met when seeing an in-network provider. Examples of preventive services are immunizations, annual physicals, flu shots, annual pap smears, and well baby visits. Keep in mind that if additional services or tests are provided at the same time, they would be coded differently and may not necessarily be covered in full. Also, if you go to a provider that is out of network, these services may not be covered in full. It is beneficial to try to see providers that are in network to ensure your preventive care is covered at 100% and that you receive the network discounts on other services. Additional information about what is considered a preventive service can be found on the SPD Benefits website. This chart is intended to help you compare premium, deductible, and out-of-pocket for each health plan available. It's important to keep in mind that the only differences in the three health plan options are the premium that you'll pay each paycheck, the deductible, co-insurance, and out-of-pocket maximums. These three things are known as cost sharing, and the HSA contribution made by the state. Each health plan option covers the exact same services, has the same prescription drug benefits, has the same wellness program with rewards, and the same provider options. Your big decision is which premium and cost-sharing combo is right for you. The in-network providers are split into two tiers. Tier 1 is preferred in-network providers with the best prices for hospital services. Tier 2 is all other in-network providers. This chart is intended to help you compare premium, deductible, and out-of-pocket for each health plan available. It's important to keep in mind that the only differences in the three health plan options are the premium that you'll pay each paycheck, the deductible, co-insurance, and out-of-pocket maximums. These three things are known as cost sharing, and the HSA contribution made by the state. Each health plan option covers the exact same services, has the same prescription drug benefits, has the same wellness program with rewards, and the same provider options. Your big decision is which premium and cost-sharing combo is right for you. The in-network providers are split into two tiers. Tier 1 is preferred in-network providers with the best prices for hospital services. Tier 2 is all other in-network providers. This chart is intended to help you compare premium, deductible, and out-of-pocket for each health plan available. It's important to keep in mind that the only differences in the three health plan options are the premium that you'll pay each paycheck, the deductible, co-insurance, and out-of-pocket maximums. These three things are known as cost sharing, and the HSA contribution made by the state. Each health plan option covers the exact same services, has the same prescription drug benefits, has the same wellness program with rewards, and the same provider options. Your big decision is which premium and cost-sharing combo is right for you. The in-network providers are split into two tiers. Tier 1 is preferred in-network providers with the best prices for hospital services. Tier 2 is all other in-network providers. The Tier 1 providers are all part of Anthem's Health Sync program. They have agreed to lower hospital costs and are focused on proactively managing patient health. This tier has the best deductible and out-of-pocket, so the plan starts paying for services sooner. Tier 2 providers are still in-network providers and a good option. Their costs are similar to what you experience today. Out-of-network providers are the most expensive option. They have not agreed to a visit cost, so there is no limit to what you can be billed. You'll still be able to use any providers you want. You can use a mix of Tier 1, Tier 2, and out-of-network providers if you'd like to. The same services are covered at all providers, but the price you pay for those services will be different if they are Tier 1 versus Tier 2. It is all about choice and helping you to find the lowest cost provider options. Next, we will walk through an example of how it all works. Our example looks at 4 visits. These are the steps we'll walk through with each visit claim to see how the tiers work together. First, we'll look at the service. Next, we'll verify the provider tier and get the estimated cost. Then, we'll look at how much has been spent so far in the year. Finally, we'll add up what's due and see where we're at in our deductible and OOP for the year. For our example, we are assuming it is the beginning of the year and this is the first visit. This employee needs a specialist visit. The employee was able to find a Tier 1 provider. That's great since Tier 1 providers have a lower deductible. This visit costs $100. Since it is the beginning of the year, the employee has not spent anything yet and no deductibles have been met. For this visit, the employee will pay $100 towards their deductible. For all these examples, we'll use the buckets on the slide to follow our deductible progress. The $100 paid by the employee applies to both Tier 1 and Tier 2 deductibles. The Tier 1 bucket now shows $100 out of $2,000 paid. The Tier 2 bucket now shows $100 out of $2,500 paid. This is called cross-accumulating. Whenever you have a Tier 1 or Tier 2 claim, the amount you pay will always cross-accumulate to both tiers. We're moving on to our next visit of the year. This time it is an urgent care visit. The employee ended up at a Tier 2 urgent care and the cost was $215. We're carrying over the amount spent so far from the last slide. That's our $100 for the specialist visit we just went through. No deductible has been met yet. For this visit, the employee will pay $215 towards their deductible. Even though this is a Tier 2 provider, again everything cross-accumulates, so the $215 gets applied to both the Tier 1 and Tier 2 buckets. We're now at Tier 1 bucket showing $315 out of $2,000 paid. Tier 2 bucket showing $315 out of $2,500 paid. The employee's third visit of the year is for a biopsy. The employee is seeing a Tier 1 provider, Since this is a higher cost outpatient surgery procedure, using a Tier 1 provider really helps on the visit cost. The visit cost is $3,400. We're carrying forward what we've spent so far on the last 2 visits, $315. No deductible has been met yet, but this visit will meet the Tier 1 deductible. Let's walk through it. Since this is a Tier 1 provider, we start by looking at the Tier 1 deductible, which is $2,000. The employee will pay the first $1,685 of the visit to meet the Tier 1 deductible. We found this amount by subtracting the $315 already paid from the $2,000 deductible. Now that the Tier 1 deductible is met, the employee is in the coinsurance phase. Coinsurance means the employee pays just 10% of the remaining visit cost. 10% applied to the remaining visit cost is $171.50. The total paid by the employee for this visit is $1,856.50. Again, everything cross-accumulates, so this amount gets applied to both the Tier 1 and Tier 2 buckets. You can see the total spent for the year of $2,171.50 in both buckets. The Tier 1 deductible is now met, so all Tier 1 visits will be at the coinsurance until the OOP max is reached. But, the Tier 2 deductible is not met yet. The fourth, and final, example is a CT scan with a Tier 2 provider for $450. On the previous slide, we saw our spending for the year was at $2,171.50. Since this is a Tier 2 provider, we look at the Tier 2 deductible to see if it has been met. It has not been met. The employee will pay the first $328.50 of the visit to meet the Tier 2 deductible. We found this amount by subtracting the $2,171.50 already paid from the $2,500 Tier 2 deductible. Now that the Tier 2 deductible is met, the employee is in the coinsurance phase. The Tier 2 coinsurance is 30%. The employee pays 30% of the remaining visit cost. 30% applied to the remaining visit cost is $36.45. Both deductibles are met. The next visit cost will be based on the provider tier that is chosen. Choosing Tier 1 providers will provide savings on the visit cost. Health savings accounts are available and exclusive to those who enroll in a consumer-driven health plan. Since the consumer-driven health plans have high deductibles and out-of-pocket maximums, the IRS says that you can set aside tax-deferred money to pay for eligible health expenses. The state does make an initial and biweekly contribution to this account based on your chosen plan, and employee contribution is completely optional. If you do choose to contribute, your contribution can be changed at any time during the year by updating your contribution amounts through a self-service HSA Life event in PeopleSoft. Funds in the account roll over from year to year, and they are yours to keep should you leave state employment. There is a waiting period for contributions to begin due to the IRS regulations, which say that HSA contributions cannot begin until the month following the benefit's effective date. There are certain eligibility guidelines for an HSA set by the IRS. You are not eligible for an HSA if you are covered under another medical insurance plan, unless it is a qualified high-deductible plan. Questions about what is considered a qualified high-deductible plan should be directed to the IRS or a tax advisor. Also, if you are covered by any part of Medicare, Medicaid, or TRICARE, you would not be eligible for an HSA. Now, if any of these things change throughout the year and you are no longer covered under these programs, you may contact the benefits hotline, and a benefits specialist can assist you in starting an HSA. Likewise, if you become covered by any of these plans, you need to contact the benefits hotline to discuss next steps. These eligibility guidelines only apply to you as the employee. Also, you may still elect one of the high-deductible plans without electing the HSA. Here are the contributions made by the state to the HSAs for employees who are enrolled in CDHP 1 and 2, and are eligible for an HSA. The state makes an initial contribution into your health savings account corresponding with your first HSA-eligible paycheck, and also a biweekly contribution. The IRS also sets annual maximum contribution amounts. For 2023, the single coverage maximum is $3,650 and the family maximum is $7,300. Employees age 55 and over are allowed an additional $1,000 catch-up contribution. It is important to note that this maximum includes the employee and the employer contributions, so when calculating the amount you want to contribute, you would need to subtract the amount the state is contributing from the annual maximum, and the remainder would be what you could contribute for the year. The state has an agreement with UMB Bank for HSA deposits. Upon enrolling in an HSA within PeopleSoft, UMB will automatically create your HSA account. Please be on the lookout for a welcome letter from UMB. You should receive the welcome letter within 7 to 10 business days from the Monday following your election. The welcome letter will contain your account number and information for enrolling in UMB HSA online banking. Through online banking, you will be able to sign up for e-statements, order additional debit cards, add beneficiaries, set up payees for bill pay, plus much more. An HSA debit card will arrive in a separate mailing approximately 7 to 10 business days after your account is opened. While all health plans are through Anthem, pharmacy benefits are provided by CVS/Caremark, which means when you go to the pharmacy for your prescriptions, they will actually process it through CVS/Caremark system, not Anthem. However, when you do go to the pharmacy, the information needed to process the prescription will be found on your Anthem card. So, you will give your Anthem card to the network pharmacy and pay the full network adjusted amount prior to meeting your deductible. If the deductible has been met, you will pay the co-insurance, which is anywhere from $10 to 40% of the cost of the medication depending on the formulary for the drug. It is important that you shop around because, just like with any other product, you will find that different pharmacies charge different amounts for the same medication. Also, ask for generics and look into mail order services. If you have a medication that you take on a regular basis, the mail order services can potentially save you quite a bit of money. Some people save up to 50% by doing a 90-day supply through mail order. CVS/Caremark offers a large network of participating pharmacies. However, there is no requirement to switch to a CVS pharmacy. For a full list of in-network pharmacies, please visit www.caremark.com. The 90-day prescriptions can be filled through CVS Caremark mail service, or picked up at a CVS pharmacy location. CVS Caremark also offers point-of-sale rebates, which reduce the cost of prescriptions prior to meeting the deductible. Finally, CVS Caremark offers a user-friendly website and mobile app to help track prescription spending, find network pharmacies, and compare drug costs. This chart shows what you should expect to pay for prescriptions after your deductible has been met. Note that the pharmacy benefits for all three plans are the same. This is called a maximum exposure chart. This is intended to show the most you will pay for your covered medical expenses in a year depending on the plan you choose in a worst-case scenario. This shows the annual premium along with the maximum out-of-pocket you will pay for each plan. So you will notice that while the consumer-driven health plans have higher out-of-pocket maximums, the premiums are so much lower that even if you exceeded the out-of-pocket maximum on your plan, and did not have a health savings account, you would still pay less for the year than on the traditional plan. Especially considering the IRS says you cannot have a health savings account with a traditional plan. The deductibles and out-of-pocket maximums may look steep, but remember that many of you will probably be eligible for the HSA and the state will be contributing money to that account to help with your medical expenses. When looking at this chart, you should remember that these figures assume acceptance of the non-tobacco use agreement as well as use of Anthem's network providers. The figures will be different if you do not accept the non-tobacco use agreement or you see out-of-network providers. You will have one card that lists the coverage you elect. For medical coverage, the card will include the prescription plan information so that the pharmacist can run claims. Once you have made all your elections, select the Submit Enrollment button. After your elections are submitted, you will have the option to review and print your enrollment summary. To finish enrollment, select the Complete button from the summary page. To finish enrollment, select the Complete button from the summary page. If you experience a qualified change in status, you should contact the benefits hotline and may be able to make changes to your benefits. These changes in status are typically referred to as a family status change or qualifying event. Some examples of qualifying events would be getting married and wanting to add spouse to your coverage, giving birth to or adopting a child and adding the child to coverage, a loss of coverage, which means that you, your spouse, or child becomes ineligible or newly eligible for coverage elsewhere and you need to make a change. Changes must be reported to the benefits hotline within 30 days of the event to be able to make changes. So, if you experience an event and are not sure if it qualifies, please contact the benefits hotline within 30 days to discuss your circumstances with a benefits specialist just in case to be sure you do not miss your deadline to make changes. Some family status changes must be reported because your dependent has become ineligible for coverage, such as a divorce where your ex-spouse is no longer eligible for coverage under your plans. Once the event has been reported, you will have an additional 30 days to provide us with the documentation requested for the change. It cannot be stressed enough how important it is to notify the benefits hotline within 30 days of an event if you need to make a change to your benefits, because if we do not know about the event in time, then you will have to wait until the next open enrollment period. Live Health Online offers employees the convenience of face-to-face interaction with a doctor 24 hours a day, 365 days a year through your mobile device or computer with a webcam. Doctors on Live Health are available to diagnose and treat a wide variety of medical care needs. Some common items include the flu, a cold, sinus infection, pink eye, rashes, and fever. When appropriate, the doctor can even prescribe medicine and send the prescription to the pharmacy you choose. The average cost of a doctor visit using Live Health is $59 or less. Behavioral health visits are also available at a cost similar to that of an office therapy visit. Anthem has some great resources available that are included as part of your health insurance plan. There is a 24/7 nurse line that you can call any time of day and is answered by registered nurses. This can be helpful if, for example, you have a child that spikes a fever in the middle of the night and you are not sure whether you need to rush to the emergency room or if it is something you can treat at home and see your doctor the next day. Or if you are out and about and get stung by a bee, fall down, or get a large cut, they can listen to the symptoms and tell you whether or not, based on your particular situation, you or your dependent needs to be seen right away. This can save you peace of mind as well as money spent on an emergency room visit versus a regular doctor's visit or even home care. Also available is the Condition Care Program, which can assist employees in managing symptoms related to the most frequently diagnosed conditions, the top 5 being asthma, diabetes, coronary artery disease, chronic obstructive pulmonary disease, and heart failure. Registered nurses can work with you and your healthcare providers to ensure you are receiving the best care and that you understand all of the information given to you. The case management program reaches out to members with multiple healthcare issues to offer support and assistance. There are also discount offers on Anthem's website. You can create your account on anthem.com and log in to view discounts available to members. There are discounts to gyms and chiropractors. There are discounts on supplies to baby-proof your home, vision and hearing supplies, and even vitamins. Don't forget, your benefits are due and must be entered by the Monday following the pay period in which you were hired. Benefits are effective 4 days after your first paycheck when paid through the auditor's office. If you are not paid through the auditor's office, your benefits will be effective the first of the month following the date of your hire. If you elect one of the consumer-driven health plans, your health savings account will be effective the month following when your benefits are effective. Do not wait until the last day to submit your elections in case you need assistance. If you miss your deadline, you will be without benefits until you elect coverage with the next open enrollment or experience a qualifying event. This concludes the presentation. If you have any questions, please feel free to contact the benefits hotline by phone or email, and one of our specialists will be happy to help. Thank you and welcome to State Employment.